Okay. Shall I start now?
Yes, ma'am.
Okay. Coming to intervention in the treatment part. So we should monitor and pay attention to your teens and the peer group and the social media sites, whatever they're watching, like the Instagram and the Facebook and the other media sites, what your kid is watching and what your teen friend is having other friends, and look for the any signs of drug abuse, alcohol abuse, other substance use. You have to notice these changes and make sure you spend some time with your teen and be involved in their activities. So these days the employment has increased, like women employment and men and women employment has increased, so both parents are going out for the work, and after coming back due to their work pressure, they are taking their own self-care. So just make sure you just have some good time with your teen and discuss what's going on, and try to indulge them, and try to make sure that we are that you are here to help them. So in that way they feel safe and they feel non-judgmental, and they try to open up to you. So are teen suicides are preventable? Yes, most of the teen suicides are preventable. Like 100 out of the 100%, most of the cases 80% suicides are preventable. So hence, one second, ma'am. You got okay. The teen suicides are preventable. So tell them and demonstrate that you love them, and increase the emotional acceptance for them. So whatever your kid and come out from your college or school, and take some time to express your feelings that you love. Obviously you love them, but by expressing and saying, they get to know, oh yeah, my mom or father is loving me, still they are there for me to accept my challenges and my negative beliefs, so they'll understand you much better. So be reasonable and teen focused in your expectations for their academic performance. Yes, the expectations of the parents, that should be the age expectations, like according to the age. If the your child is around the 12 years of age, make your expectation up to 12 years only. Don't make expectations more than a 12-year age boy or a girl. So keep your expectations age appropriate. So that's another tip. And be very quick and decisive regarding drug and alcohol use boundaries. Yes, when you find out your teen or your kid is having a drug and alcohol use frequently, like occasionally, just look after them and make the boundaries, and explain the use of the abuse leads to how this affects your physical and mental health. So make sure that you look after these drug and alcohol abuse too in your teens. And these and interventions are also for the people who are around the teen, like friends and the family members can also look after the teens. So this is an intervention. And the next slide, ma'am. Okay. Remove all hazardous weapons and firearms from the house. It's obvious that the younger ages are like see from the environment, like whatever they see. If they see scissor, if they have the intent in their mind, the guy or she or he having an intent. If they don't see any weapons around, or equipments like pesticides or ropes, they don't try to commit, because the lack of sufficient weapons around. So make sure that you remove all the hazardous weapons or firearms around the house. And if the parents are divorced, make sure to notify and enlist the help of other parent when possible. And keep up with the treatment. If the child or teen is going to some treatment, whatever it's a medical and the mental health treatment, keep up with the treatment and the medications, and make sure that the teen is going to the particular follow-ups of regular medications. And longer is better, as the risk of suicide and overdose is often great after the crisis is over and things are back to normal. So combination of individual and the family therapy are usually advised and have better outcomes. Yes, even I tried in my clinic, I tried individual and group therapy along with the family. There are much better results when the family is included in the therapy for the teen. And now the teens are having better coping skills after the therapy. So do not tolerate any drug or alcohol use with the teens. So if your teen is having a drug or alcohol abuse, just don't tolerate, or else you may find that my husband is also having an alcohol use, so it's okay. He will understand, the teen, he or she will understand about the don't know. You have to guide them because they don't know the consequences. You have to guide them how these drugs are affecting their health. And next slide, in the acute phase means the initial phase when the teen is having suicidal ideations or suicidal item, what you should do. So talk directly to your teen about the suicide or self-harm. You won't give them the any ideas or suggestions. Just talk to them, because by giving an idea, he may get offended. The person who are going with the stress and suicidal ideation, they want someone to listen. That's it. They don't want any suggestions. So talk to them, and just listen to them. Ask specifically about the situations and the feelings and what you have noticed in them, and ask if they have thoughts about killing themselves. If so, what was the plan, or how would they do it? So ask them how they want to do it and how they want to cope up. So you just ask, don't give any suggestions to them. So enlist the help of like coaches, their teachers. The teen are going they're spending more time in the colleges and the schools. So take help of the teachers and ask the teachers how is the behavior of the student or a uh, uh, teen in the during the past few months, whether there is a difference in the behavior. So you can take information from the teachers to school staff for the information and the support. And if intent is expressed, seek immediate. If a teen or if a kid is expressing that I am becoming hopeless, I am becoming worthless, I don't want to live this life, these are all the warning signs I explained earlier. If he or she is showing those warning signs, you must immediately seek an immediate help from a professional, especially the mental health professional, psychiatrist. You should seek an help. So those people, professionals have an idea how to deal those cases, like how to diagnose what particular treatment is needed for the kid. So get a suicidal risk assessment done by a professional and develop a weekly treatment plan to address suicidal ideations and underlying issues. Okay, next, ma'am. So reminder for friends. This is up to like up till now I told about how to take care of your kid as a parent, as a professional health, mental health professional. But most of the teenagers are with their friends, so their life is more colorful with their friends, and they go out with their friends. So it's further reminder for friends. So how to connect? Connect is like listen, be accepting, and don't judge. People expect the people, like be non-judgmental, listening to them in a non-judgmental way. Don't judge their behavior, don't judge their attitude. If there someone is sharing their griefs and sorrows at their homes, if someone parents are going through some struggle, they want to express, let them express. Don't judge like, oh, your parents are like that, or your thought process is like that. Don't judge, just listen. So confirm, connect with your friend and confirm. Ask if your friend has thoughts of dying or suicide. You can ask your friend by whether they have any suicidal ideation. By asking that, will not create any suicidal ideation, that you are not going to install that ideation into your friend. So you can confirm whether he or she is having that suicidal ideation. Protect. Take their stress seriously. If the person in a comical way, in the joking way, whether he or she is expressing that I'm gonna quit this life, I'm done with this studies, and if she is having struggle with the studying, and if she or he giving the threats, take those steps seriously and don't agree to keep any secret, because it's very high time to take those threats seriously. So next, stay. Do not leave a person alone if you are concerned about them being at an imminent risk. Act. Next step is an act. Call for the help immediately. Help is a kind of help, like first you intimate their parents, and the parents should seek an immediate professional help. These are the five steps for the friends to connect with their other friends who are suffering from the depression or anxiety, some other stress, and some having the suicidal ideations. Next step, ma'am. So these are the some kind words to say who to the teens who may be the suicidal. These words may help to calm down their stress and anxiety. So these are the words you can say, are you okay? And whenever you want to talk, I'm here to listen and support you. And the another point I want to mention here is don't force them. As I'm saying, talk to them and ask them. And if the person is not supposed to share, don't force them to share those feelings. Let them freely allow them to share. If they want to share, let them share. Don't force to talk to them, talk to you, and talk to the others. So whenever you want to talk, I'm here to listen and support. These are the words to tell to your team. I will never stop supporting you, no matter what challenges you face. And the another words are like, there is no problem too big for us to get through as family. And I want to make sure you get the help you need to feel like yourself again. These are the kind words you can say to your team that may help to cope with these negative thoughts. The other, this side of the slide is showing the Asara is a government helpline providing to listen to the people's sorrows and griefs, and they are here to help us to find out any professional help and to prevent the suicidal behaviors and prevent the suicides and come down the number. And whatever number we are seeing here is like very high, it's touching roof. So these are the helplines given by the government Astra. You can, if your team is having trouble, you can contact these helpline numbers. This might help. So next slide, ma'am. This is an given by International Association of Suicide Prevention. This is our team creating hope through the action. So what is the action we create by hope is like reaching. You can help give someone hope by showing that you care. All of us can play a role, no matter how small it is. You have a role to play, and we all can reach in and ask somebody. And you do not need to tell them what to do or have a solution, but simply making the time and space to listen to someone about their experience or distress. So reach in. Don't just sit with them and just listen to them. Like our elderly people say that our sorrows and griefs come down when we share to some others and we pen down in our thoughts. It's almost 50% of our sorrows come down when we share with the others. So reaching to their sorrows and encourage understanding. So there is a lot of stigma over there regarding the mental health illnesses. So try to break the stigma. Stigma is a major barrier to help seeking. So change the narrative around the suicide through the promotion of hope can create a more comprehensive, more compassionate society where those in need feel more comfortable in coming forward to seek help. We can all do something to live in a world where suicide is recognized, and we can all do something to help prevent it. So other one is sharing the experiences. Though sharing experiences are by the suicide who came out of the suicide. Like some may have attempted the suicide and they came out of from the suicide by the treatment by the health professional. So you can seek experiences from the person who already committed a suicide, but now he or she is leading a good life. You can take an experiences and share those experiences to them. So you can be the light and you can spread the light to them. Next slide. So this is the end of my presentation. Live and let live. So this is my presentation, ma'am. I'm glad that you gave me the opportunity to share my bit of knowledge, ma'am. It's a pleasure to be with you. And as already madam said, ma'am, there is another video, I guess. No, I can't hear your voice, ma'am.
These two are the videos which I have.
What?
And
Okay.
yeah.
So I want to share you people, you guys who are watching this video. I want to share a simple grounding technique. This grounding technique is I usually practice in my setting. So I give it to my patients and clients to calm down. It's not like a complete therapy kind of thing. It's a grounding technique to initially cope up with the stress. that not pile up to reach the suicide. So whatever the initial stress or suicide ideations are there, you can cope up with this little grounding technique. So I'm going to share with you all with the grounding technique 5, 4, 3, 2, 1. Ma'am, can you show that slide, ma'am, the last one?
Yes, before that, can we have few questions if possible?
Yes, ma'am. Yes, ma'am. Yes, you can ask.
Actually, what I want to know, certain myths are there, ma'am. As you have given elaborative talk, and we have a lot of things cleared in our mind, but few myths are there, like these people who talk about suicide, but they don't generally do suicide, or if they attempt, will not go for attempt, or who attempt suicide, they are weaker. Are these myths are real, or what you will say about these myths, ma'am?
No, ma'am. Actually, the first point you said, the people who talk about suicide are just trying to get attention is just a myth, ma'am. The people who talk about suicide, they are more likely to commit a suicide. That's not a correct statement, ma'am. That's a myth. So just if the person or a teen or around your friend is talking about the suicide, just you have to take care of them and ask them to go for a help, or you can take seek a professional help also. That's not a myth. That's a myth, ma'am. It's not a fact. The second point, the people who attempt suicide and the survive will not suicide again. I already mentioned in the risk factors, the another major risk factor is who already attempted suicide are more at the risk of committing suicide rather than who didn't attempt suicide in the past. So the person who committed a suicide are more likely to commit suicide in future. So just be they have to be careful in their treatment and follow up. And the other myth is people who attempt suicide are weak. No, not at all. They are not weak. They are in the pain. They are in vain. They are in complete plain pain, and they need a lot of courage to do a suicide, ma'am. As we all know, even when I'm having a GRBS test, like a small prick, I suffered a lot of pain. How the weak people can commit a suicide? No, that those people are not weak. They are in pain, but they are strong enough to commit suicide. And next, we
Few
continue our
common
question.
questions we have, ma'am. When I asked about this topic, many have certain questions, common questions. Can you please consider and suggest us about these questions, ma'am? You can go through.
Which gender commits more in teenagers? Yes, there is a gender equally, both male and female genders are committing suicide in teenage groups. As the age grows, men are committing more suicide rather than female. But in teenagers, generally around the females, if you consider female, around the menstrual age group, in during the puberty, there are more chances uh, to commit suicide, and there is no gender difference in teenagers, especially teenagers. Both are at risk of committing suicide. And next question is, even teens will get depressed, and what are the symptoms? Yes, even teens will get the depression, and there are a lot of studies, and even I have seen cases, not only teens, even the children below the age group of 9 years. I have seen a case recently. The 6-year-old boy came to brought by his grandfather and the grandmother, saying that his academic skills are very poor. He previously was very good at marks, and he was doing very good. Now since past 3 years, he's not doing good in studies. He's a very clever boy, couldn't able to do these days. What is the problem? They came and for the help. So when I talked to that boy, he expressed a very, he was very he looked very dull, and no hope in his life. So when I asked about the reason behind this phase and whatever his sorrows, he said his mom died. His mom left him actually at the age of, like, when he was born. He left her baby. She left her baby in the church, I guess. She said in the church, as he was an unwanted kid, and she left her husband too. So the child was brought up by his grandparents, and recently he got to know this incident by some other aunt, someone talking about his mother that she left this kid due to some reasons. From then he started developing these depressive symptoms, like repeated negative thoughts, why my mother left me and why my parents are not there, why uh, back till 3 years back he was referring their grandparents as parents, and recently when he got to know that his parents his mother, especially his mother, left him for some reasons because he is some physically disabled kid. So he developed a depression. He tried to commit suicide, but he couldn't. And now he's on the treatment medication. He's even started on we started on antidepressants now. So basic a little bit like my minimal doses we started. Now he is improving and he's going back to school. He's including academics now. So yes, teens also get depressed, and symptoms are what are the symptoms, like symptoms of eating difficulties, sleeping difficulty, couldn't able to sleep properly, and concentration difficulties, couldn't able to concentrate on studies, and whatever anhedonia. Anhedonia means previously the teen have some pleasurable activities like going out with the friends, watching a movie. Those pleasurable activities feels like very unpleasurable these days. Those are all the symptoms that can be seen in the depression, ma'am. So are they preventable? Yes, there are a lot of options for an n number of mental health disorders. Yes, they are preventable. There are a lot of treatment options available. What are the treatment options available? Yes, for different mental health conditions, there are different treatment options available. Most of them like major for the major depression, we have if the patient the severity, based on the severity we can prescribe some antidepressants, and if the severity is less we can suggest them some therapy, and some other anxiety disorders, bipolar disorder, we have to diagnose them first and give the treatment, and mood stabilizers are there, so a lot of treatment options are available now. Yes. And a lot of people have a myth that psychiatric medications are only to make people sleep and whatsoever. Yes, I heard this statement from many of my colleagues, even my doctor colleagues, that psychiatric medications are only for the sedation. No, those are not only for the sedation. And one second, ma'am, my video. Yes, those are not only for the sedation. Those medications are made to make your hormones, whatever I explained earlier, the serotonin and some other hormone, dopamine, to regulate those hormones. We are prescribing medication. Some medications, like even antidepressants and antipsychotics, have some sedative effect, like and a side effect, like paracetamol having the gastric side effect. Those have some sedative side effect. That's it. Those are not the sedatives. There are some sedative medication we prescribe in acute phases. Suppose if a suicide intent case is approached to me, that patient and the teen is having acute suicidal ideations, and he may run away anytime from the hospital. In that case, we suggest the sedatives, because to sedate, if the patient is sedated, he couldn't able to commit a suicide by running away. So initial phases we provide sedatives, and gradually if the patient is okay, then we shift to the antidepressants and some other medications. And what role teachers play? Yes, teachers really play a major role up to the teenagers, even up to age of the 20 years, because we are more most of the time we spend our time with the teachers and the professors and the lectures other than parents these days. So teachers should identify the risk factors and identify those warning signs, whatever I said, like if the teen is not concentrating on the studies, if the teen sudden change in concentration. Teens, some child are by birth their intellectual capacity is low. Those students you can't identify there's a difference. The boy or girl is previously well talented, now suddenly shifted to reduced concentration, then you have to take a help of a professional. So yes, teachers should have a role, and they should monitor their students, and every week one day should have a camp, like mental health camp, to identify those any teenagers suffering from any other mental health disorders. So next question is what kind of personality disorders commit suicide? Yes. what is a personality? Personality is the way each person is different in their own way. We all have some personality traits. That's all we are human beings made of. So some are very aggressive, some are very quite polite, some are very adjustable to the environment, adjust to the some other people. Some don't adjust, they couldn't able to adjust. Some are very attention seeking. Even we can see some like our politicians and some our director, they all have some personality traits. So if those traits are reaching maximum, if some traits are more rather than the other trait, it leads to the disorder. So particularly borderline personality disorders. Borderline personality disorders are very common. How they commit suicide are, I have a patient, female patient, 18-year-old girl. She is having diagnosed with a borderline personality disorder now. Initially, she came with the history of multiple cuts on wrist or on the left hand, because she is a right-handed female, and she had a multiple cuts on the left hand. So they brought her as she's couldn't able to concentrate on the study. She's making these cuts, and after the initial assessment, I gave that treatment. We gave given this therapy, and we sent her back to the school and parent setup. So after the later. After 2 months, again the parents brought her to the our hospital by saying that still she is not concentrating on the studies. By after saying so, I checked the wrist again. There are no fresh cuts. They're all the old cuts. There is no any parasuicidal behavior. Then what after the repeated questioning, what she said is, "Mm, ma'am, on the wrist, I think everyone was seeing my wrist because of multiple cuts. Now I'm making cuts under the thighs because those are not visible to you people, so they can't judge me. She's making cuts under his thighs, groins. And later she also tried to have tattoos. Tattoos also are painful. They want that pain, they have that pain to be more pleasurable, and they want to the pain to come to their body. So these personality disorders are particularly borderline personality disorders. They seek love. They have multiple relations. They can't, but they couldn't able to maintain that relation for so long. They break up again. They'll make another love. So they have their identity disturbances. They don't know what they are. So these are all the personality disorders you have to concentrate. So based on the severity of the disorder, you can give a therapy. Especially dialectical behavioral therapy is very helpful in these patients. Like they have emotional dysregulation, their emotions are not regulated well. So for this emotional dysregulation, you can have a therapy and medications too. So how does, next question is, how does physical illness affect suicide? Yes,
Along with
physical
this, I have
illness.
as a gynecologist, with this question, I relate
Yes,
somewhat. Like a few
yes,
of
ma'am.
my patients, as I'm a infertility consultant, lots of patients come to me with the PCOS, with infertility, subfertility, as they have their partners telling them, you have some fault in you, so we are not conceiving a child from many years. And a few in-laws are forcing on them, if you are not able to give us child, we will have another marriage for our son. Like those verbal disturbances, our patients are coming with few complications, like they want to end their life, or they want to go away from their people, or diverse till diverse if thing comes, they want to end their life. And few things like if they have some health issues, like severely anemic, or severely they are having any cervical cervicitis, and they are diagnosed with some cancer, uh, just they want to end their life without thinking about treatments. And they're not able to understand. For such patients, if we ask them to go for a psychiatric counseling, even that, even then they are feeling like it's not a mental disorder, we have some other disorder, why we should go to a psychiatrist. But we are telling them to have proper counseling, to have proper intense feeling, which is right, which is wrong. So for those type of students, those type of patients, if they come to you, is it helpful, ma'am, and how we can encourage them and how they can be sorted? And please give us some light about this, ma'am.
Yes, ma'am. As you said, physical illness, it's like a patient going through some crisis. I say it a crisis. Like during the crisis, the all coping skills will go down. So every person has their own coping skills. But when the person is suddenly diagnosed with some condition like a cancer, some early age, particularly in teenagers nowadays, early onset diabetes and early onset some other syndromes are getting diagnosed. So when suddenly some disorder is getting diagnosed, all their coping skills are below the graph. So they don't know how to cope with this. So you can say as like currently you are very vulnerable, so your coping skills are very low. You need someone to help in coping your skills, to rise those coping skills. You can say like you might need a coping skill enhancement. It's not like a mental health. You are not in a like some mental illness. Your coping are very low. That's why you are having these ideas of suicidal ideations. Once the coping skills goes up, it all subsides. To rise those coping skills, to enhance those coping skills, you should need you have to go for a help, that particularly a mental health professional. That you are not still diagnosed with, you can say to your patient, you are not diagnosed as a mental health a mental illness, so why should you are concerning about the mental illness? Just go for a psychiatrist to cope your increase your coping skills. That's it. You can guide them to psychiatrist, ma'am. That's my opinion. And another recently, I had a patient like a 15-year-old boy. He came to me as a he committed suicide by taking a pesticide at their home. His father is a farmer, and well, his
Yes,
father
ma'am.
is a farmer, and like he has a pesticide in his room. He mixed it in the buttermilk and he had that pesticide, and he was brought to the hospital. The reason behind the pesticide abuse and pesticide use was he was recently diagnosed with the type 1 diabetes, and he has to get daily 5 insulin injections because his condition was so severe that he had to put on a like kept on a 5 injectables like daily doses insulin injections. He was studying in a college, reputed college, where the remaining peer groups are bullying him, saying that you are injecting some drugs. I will complain to the principal, and you are the drug abuser. And they started bullying him. Out of this bullying, and once his friend complained about this behavior to his parents, and eventually parents got to know. So this is a situation. Out of bullying, he has to commit the suicide. He wants to end life. Even after the after the first meeting, he was still want to die. He was very hopeless. Why should I live, ma'am? I'm already having diabetes. I have to take 5 injections, insulin injections per day. So my body became so hard by taking injections. I don't want to live. But eventually he came out. I'm glad that he came out with the medication. But medication need is there if the patient severity, the severity of the illness, based on the severity, we have to keep the medications, ma'am.
Ma'am,
And
in 1 minute, can you please enlighten us once again on this counseling center and confession box?
yeah, sure,
Open
ma'am.
hospital.
Okay. So I yeah, conflict focus like as we see in like movies. Recently, I was watching a English movie. I don't remember the movie name. There the heroine was going to the confession box in the church, where she was expressing her sorrows and griefs to the person sitting behind, the priest sitting behind her, without showing her face and identity, disclosing anything. So after seeing that, I got an idea that yes, you can use this idea in our counseling center to help the teenagers to confess their feelings. So yes, as earlier I said, by confessing, yeah, by saying almost your sorrows and worries comes down. I definitely agree with this point. Even I practice it daily. Whatever worries, even everyone are going through some stress and turmoil because stress is inevitable in our life. It's part of our life. So we have to deal with the stress. So if you initial stress, if you have some coping skills, if you went out those feelings by writing down or sharing with the friends, you can stop that. You can break the chain of suicidal ideation. So with the confession boxes, you can drop your worries and sorrows in those box without revealing any of your identity and details. If ever however, if you want any mental health professional help, we are going to provide helpline numbers on the box. If you want to share, you can talk to us. If you want to confess something by verbal communication, you can talk to us. If you want to communicate by writing, you can write it down and put it in the box. It's an initial coping mechanism, ma'am. So it's not. It could it won't work in every situation, but it helps them to break those initial stresses before going to the suicides. So it helps actually, ma'am. Previously we used to write diaries. That's a good idea back then, but nowadays no one are writing diaries, and the thought diaries are previously they used to write, but nowadays diaries are not using these days. So I encourage personally everyone, even doctors, we have a lot of stress, so write your own diary, vent out your feelings, and so that it makes you feel alive. And this is take home message. My take home message is
Thank you so much, ma'am. And we want your take-home message, and it
yes,
looks very interesting. Last 2 minutes, ma'am. And thank you
yes.
so much for your all this explanation. Thank you so much, ma'am. And your take-home message, ma'am.
Yes, yes, this is a wonderful grounding technique, ma'am. Even I tried on many my clients. It's like not a complete treatment, but it's full grounding technique. You can practice your daily stresses when you are. Uh, as you know, ma'am, we are like bound by past and future. We are bound by past and future. So our past mistakes, our past behavior influences our present, and even future expectations also influences our present. So between these conflicts between the past and the future, we are confused in the present. So in this grounding technique help you make you alive in the present, to stay at the present moment, should not worry about the past and should not worry about the future. So
Last
this is a
1 minute, ma'am.
5 4 3 2 technique.
Yeah.
Yes,
Last
yes.
1 minute.
Five. Yes, ma'am. So five is just observe when you are in the stress and you couldn't able to cope. Just do this technique. First thing is five things you have to focus around you. What things you can see around you? Just see around the five things and notify those five things around you. And then four is four things you can touch around you. Try touching four things around you. And next is the three. Three is focus on the three things that you can hear around you, ma'am. So just stay silent, hear whatever the three sounds you're hearing, and the two things you can smell around you. And two things you can smell around you, you should acknowledge that. And lastly, acknowledge one thing that you can taste around you, like what something you will have. By doing this technique, obviously you live in the present. Whatever things are surrounding make you alive and stay focused for the present. And I hope this lecture helped you, ma'am, and helped the audience. And I
Yes,
hope
ma'am.
this created awareness. And I hope will come the suicides rate next year, when we are gonna talk about the suicide prevention next year. I hope the numbers should come down, ma'am.
Sure.
With
Thank you
our
so much. Thank you so much, ma'am, for your elaborative explanation and coping technique.
yes,
Thank
ma'am.
you, audience. And I hope this will be very useful for all of you. And we will come up to the offline programs as well with this topic. And thank you so much.
Thank you, ma'am.